All right, so we talked about the skull. Let's move on down. We're still on the axial skeleton, and now we're talking about the vertebral column. So the vertebral column, also called the spine, is composed of individual vertebrae which stack on top of each other to house and protect the spinal cord. And the vertebral column has 4 curvatures to it. There's one right there. There's one right there. One right there. And then one right there. This is your cervical curve, your thoracic curve, your lumbar curve, and your sacral curve down there. And what this does is it allows the spine to function as a spring rather than a rod. So it absorbs, when you jump off of something, it absorbs a lot of shock just because it is curved, and so there's less physical stress on the spine. And then I'll let you guys match each vertebral curvature, or I'll let you guys decide which vertebral curvature is exaggerated in each one of these conditions here. All right, so the vertebral column protects the spinal cord. As you can see, there's a spinal cord deep within the vertebra there. The vertebral column is supported by muscles and ligaments which reinforce its structure. They give it more stability. So you can see all these ligaments here. I highlighted them green, but these are all ligaments here. These strap-like system that's reinforcing the vertebral column, and these are all the muscles that are on it as well. The vertebral column is also separated by intervertebral discs, and we'll talk about those a little bit more, but these again are acting as shock absorbers to absorb shock. They allow the spine to flex and extend, and yeah. The vertebral column also allows for the passage of spinal nerves into the spinal cord. So when you stack 2 vertebrae on top of each other, you get an opening called the intervertebral foramen. And the spinal nerves are going to pass through these intervertebral foramen to get access to the spinal cord. The vertebral column also transmits the weight of the trunk to the lower limbs. So the spine is carrying all this weight up here, and it gets transferred to the lower limbs. It travels down the spine, travels into the hip, and then down into the femur here. And that has implications for backpacking, whether or not you put the weight on your hip there, or if you put it on your shoulders. If you put it on the shoulders, then all that weight's got to come through the spine. If you put it on the hip, and in particular, you can see your iliac crest right there. This is your iliac crest. Then what that does is it takes weight off of the spine and instead places it on the hips, which transfer it down to the femur. All right, so there's 5 major regions of the vertebral column, and this is an anterior view over here. So if this is where your head, these would be your eyes, your mouth, something like that. So the first region is the cervical region. And these are the cervical vertebrae, C1 through 7. These are the vertebrae of the neck. And again, you remember that slight cervical curvature right there. Then we have the thoracic vertebra, and the thoracic vertebrae are T1 through T12. These are the vertebrae of the chest. And there's your thoracic curve. Then you have the lumbar vertebra, L1 through 5. These are the vertebrae of the lower back. We have the sacrum. The sacrum is actually 5 fused vertebrae, 1, 2, 3, 4, 5. So that's the sacrum. And then we have a coccyx, little tailbone down below, which is 4 fused vertebrae as well. But you guys are going to be able to take these and name and number each one of these vertebrae when they're in a full vertebral column like so. And the way you can do that is by counting. Okay, that there's 7 cervical, 12 thoracic, 5 lumbar, and a good way to remember that is you eat meals at 7, 12, and 5. 7, 12, and 5. Also about these vertebrae, they're increasing in size as you move inferiorly, and that's because they're supporting more weight as you go down. Okay, so there's a common structural plan for most vertebra. This is anterior here, this is posterior. And all vertebra, most vertebra, have a spinous process, which is a posterior projection there. So that's, they all have a spinous process. They have transverse processes there. They have a they all have a vertebral foramen for spinal cord passage. And they all have a body. And this is the weight-bearing region here. All right, so let's go through and look at some of the characteristics of these different vertebrae. So first of all, we have the cervical vertebra, C1 through 7, the vertebra of the neck. These are the smallest and lightest, okay? They're carrying the least amount of weight. And C1 and C2, the atlas and axis, these are highly modified. These are the exceptions to vertebra structure. So we'll talk about those, and then we'll talk about C3 through C7 there. So the atlas is C1. Okay, this is the first vertebra. It doesn't have a body, and it doesn't have a spinous process, as you can see right there. But what the atlas does is the head rests on the atlas. So here's the head, and specifically, the atlas has these faucets called superior articular faucets. And those are those right there. And they receive the occipital condyles of the skull. Those are the occipital condyles of the skull, and those are there, like so. So the head, these two condyles, sits on the atlas at these superior articular faucets. And what this does, this joint that's formed, it allows for nodding your head yes. Then we have the axis. The axis is C2. And what's characteristic or distinguishing about the axis is you have this, what's called a dens. And the dens is it's a knob-like feature projecting from the anterior side of the vertebra. And what it does is the dens cradles in this anterior arc there in the atlas. And what it does is it allows the atlas to pivot around that dens. And what that does is it allows you to, as if you're shaking your head no. And also there's no intervertebral disc between C1 and C2. Now C3 through C7, they have an oval body here. There's a triangular vertebral foramen. The spinous processes for the most part are short. They project directly back in their bifid, which means that they're forked. Okay, so that's what bifid means right there. And that's a good way to tell a cervical vertebra. But the best way is by looking for something called this, the transverse foramen. It's a hole in the transverse process. Each cervical vertebra, C1 through 7, contains a transverse foramen, and what passes through there, these are where arteries pass through to serve the vein, the vertebral artery, for instance. So you're only going to find these on the cervical vertebra. Okay, then we have the thoracic vertebra, all T1 through T12. These all increase in size from first to last. They have long downward pointing spinous processes. And they look a whole lot like a giraffe. Okay, so here's the snout of the giraffe, and there's your long spinous process. We have some horns here. There's our horns. We have some ears. There's our ears. So you can just picture that giraffe, and that'll take you to it. Okay, so all thoracic vertebra articulate with ribs, and all ribs articulate with thoracic vertebra. So that's characteristic of those. And you can see here's the rib, here's the shaft of the rib, and it comes around, and there's a projection there called the tubercle, and this is the head of the rib. So the head of the rib and the tubercle both form joints with the thoracic vertebra there. And then it comes and it curves around like so. The lumbar vertebra, L1 through L5, these are the lower back, the small of the back. These receive the most stress, so they have a sturdier structure. They have massive bodies. Okay. Now, because they bear so much stress, then over time, you get this collective physical stress, and it can cause what's called lumbar degenerative disc disease. And this is degeneration of the intervertebral disc that's separating the lumbar vertebra. And they tend to degenerate more than others because they receive so much stress there. This is a common cause of lower back pain. The spinous processes of lumbar vertebra are short, they're flat, and they're kind of hatchet shapes. So they're big, they're robust, and they project directly backward. And what this is this is an adaptation for the attachment of large back muscles. So these are muscles here, the iliocostals. Collectively, these are the back extensors. So it allows you to extend your back like so. But yeah, they're those muscles attached to the spinous process down there on the lumbar vertebra. And these guys look like a moose. Okay, here's the nose. Even looks like the nose there. A little different. Here's our ears. And there's our ears there. Here's our horns. There's our horns there. Okay, and then we have the sacrum, and the sacrum are formed by 5 fused vertebrae, S1 through S5. So there's 1, 2, 3, 4, 5. It articulates up here with L5 and down here with the coccyx. The body's center of gravity is about 1 centimeter behind this landmark here we call the sacral promontory. And then we have these sacral foramina. Foramina is just a small hole. And what do you think passes through these sacral foramina? The answer to that are spinal nerves. Okay, so sacral spinal nerves pass through these sacral foramina to go to where they're going to service. Now laterally, the sacrum articulates with the 2 hip bones. So there we go. And so yeah, the sacrum articulates with the hip bones there, and the joint that forms is called the sacroiliac joint. So this is the sacroiliac joint right there. And well, I think and the weight of the body has to pass through this joint. So the vertebra have all this weight that's on them, and it passes through the sacroiliac joint on its way down to the femur there, to the lower limbs. So yeah, there's stress on that joint as well. And we have the coccyx, this small triangular bone right here, our tailbone, 4 fused vertebrae together, and it's pretty nearly useless for us nowadays.